I'm Anja Byg from the James Hutton Institute in Scotland, and we're one of the partners in the Roadmap project. Our role in the project is to lead what we call Work Package 2, as well as being part of the country teams that do their own case study work in each country. So as part of Work Package 2, what we would like to do is to really zoom in on what is happening on the ground on the level of farms. So we want to go out and talk to farmers about what they do, how they perceive issues in relation to animal health and the roles of antibiotics and other antimicrobials. When do they decide to use them, as well as have they had any issues both with the animals or in relation to people working on the farm about antimicrobial resistance. In addition, we also want to know what do they see as barriers and changes. So when we're talking about what's happening on the level of the farm, it's not just to say the farmers have to do something, have to change. We recognize that obviously what happens on the level of the farm is related to what happens at other levels of society. What is going on with regulation, what is going on with pharmaceuticals, how are the market structures influencing what they can and cannot do. So we're really interested in learning about what farmers do, how do they experience the situation, what do they see as important. And it's not just about farmers, it's also about veterinarians. So we'll also go and talk to veterinarians about how they interact with farmers. How do veterinarians, for example, make decisions about when or when not to prescribe antimicrobials? And again, we want to see also what the vets do in relation to the wider context. How are they being enabled or constrained in what they do by wider structures, by how their business functions, as well as regulation, as well as values and their own aims at what does it mean to take good care of animals. So we're basically really trying to understand people's interactions with animals, with different people at the level of the farm, and see how that influences what happens in terms of using antimicrobials and what might happen in terms of antimicrobial resistance.